4, 3, 2, 1. We are live now.
Thanks a lot. On the behalf of Wockhardt Limited, I welcome you all for this academic webinar series in collaboration with OrthoTV. So today we will be discussing a topic that is role of denatured type 2 collagen and apelapine combination in the management of osteoarthritis. And today to deliver this talk and subsequently for discussion, we have very renowned orthopedic surgeon and orthoscopic surgeon, Dr. C Jagadeesh. So with his kind permission, I will begin the proceedings for today's meeting. And let I to introduce you Dr. C Jagadeesh, who is Chief Orthopedic Surgeon and Director of Robotic Joint Replacement Surgery at Ashok Hospitals, Bengaluru. Then he was also consultant orthopedic surgeon and head for sports orthopedics and orthoscopic at Fortis Hospital, Bengaluru for 8 years. He also worked in Chennai at Miyot Hospital for long 10 years, and he was head of department and chief orthopedic surgeon over there. Then he is trained professional for orthoscopic surgeries and total joint replacement surgeries like knee replacement or hip replacement, accomplished over 8,000 knee surgeries and over 2,500 shoulder surgeries. He has many fellowship training, and remarkably, he got fellowship from Switzerland as well for advanced in knee replacement. And there are research papers published in national and international journals to his credit. He also conducts a biannual national conference named Ortho Bengaluru Meet at Bangalore. So with this introduction, I will invite Dr. C Jagadeesh to deliver his talk. And I will request all the audience to put their questions and queries in the chat box or Q&A section. And at the end of his lecture, we will ask him all these queries. So today's topic is very much important because of aging population and because of lifestyle. The osteoarthritis incidence is rising in India. So let's hear from the expert. So over to you, Dr. Jagadeesh.
Thank you very much, Dr. Ravi, for the kind introduction. And thanks, Wockhardt, for the, in a very important topic to be discussed in the national forum like this. And it's my pleasure to give a lecture on the use of an undenatured collagen type 2, especially in an arthritis. Yes. So I'll go to the stream now, show the complete share screen. Yes. Am I screening now?
Sir, it's not visible. You just share the screen. We will let you know.
I'll just screen the screen.
Yes.
Okay.
Now it's visible. You can.
Now it's visible, right? Oh, okay,
yes.
right. Yes.
Yes. Perfectly audible,
yes.
visible. So you can go ahead, sir.
Yeah. So with the probably for 3 weeks before that, I was associated with the Nasra hospitals in Bangalore, and now later moved to the Kaveri hospitals, the Bengaluru, which is one of the largest chain hospital after major Apollo, Fortis, and other Manipal hospitals. One of the going to be largest in Bangalore now. So I'm the senior orthopedic surgeon over there and the robotic surgeon in that. And we know that I think many of our colleagues who are being in the forum right now, is in the chat now, will be undergoing the many of the people who come with an arthritis, and they know that how sometimes it might be difficult in treating them, especially in the conservative management as an orthopedic surgeon, because many at times we feel that we'll tend to operate them, and we have to decide at the times like when is the operating schedule to be done to these people. And this is the burden of many of our people in societies when they get to the pain and they're really debilitated, and that halts them, the lifestyle of the most of the people. In India, so you can see from 1990 to 2019, the amount of an osteoarthritis which been the seen, and because we have been excruciating very nicely, immediately imaging the people with an x-rays, and in case if suppose if you're really doubtful, we go for an MRI. So that has made us to get into the what type of arthritis now we are dealing with the people. You can see that year by year the scale of the people whom we are really diagnosing in arthritis is little bit an increased. And if you look at the prevalence of an osteoarthritis in India, in the states now, if you see that most of the people, in the red, they are really then alarming is very high. And see that in the Punjab, Rajasthan, and the Kerala, so the numbers compared to the general population is really high. Probably in that I can relate it to in my own state in Karnataka, where we see a lot of people who come with an arthritis in the we have seen that could be related to the fluoride content in the water. And I've seen that people, around the 40, 45 years, they come with a grade 4 arthritis. So the looking at the geographical variations of an arthritis, definitely we need to look into it, how early we need to management sometimes, rather than waiting for a long period and all. So what I feel is sometimes, definitely the age might not be a criteria in giving a quality of the life of the people. In at times we have to consider the quality which we have to give them in future, so that they can go for a pain-free lifestyles. So the treatment options which we look into it is, you can see that this is a famous triangle which we regularly see in every of our discussions. The first time when we see the patient, we usually advise the educating the people how to reduce their pain for themselves. Some people, they are very much inclined to the activities, like they are very good in climbing the stairs. However, it is the fourth floor, fifth floor, whatever the floors and all, they would like to walk the staircase, climb the staircase. That may have seen that that increases over a period of time the patellofemoral arthritis. And some of the people nowadays, they are very much happy in going around the cycling, bicycling, and the trekkies. So all these the activities definitely going to changes the patellofemoral mechanisms, which leads in arthritis. So we need to advise sometimes into the people wherein they have to cut down all these of activities to bring down their the pain scale to the normal without taking any other medications. And also, especially the females, if they're really squatting, so that we need to advise. And people who are really obese, definitely we have to consider them to advise them, because the weight which has a direct related to the patellofemoral pain in the beginning, then later they will get the middle patellofemoral compartment arthritis. And exercise as such, definitely we need to tell them that it is the one which relieves the pain and reduces the deformities and relieves the pain from there. So information and advice like this to relieve their pain by doing exercises or educating them to how their lifestyle modification has to be there, it's really in the beginning of our first advice to them. So advice along with that definitely will not be a suffice. We have to sometimes go with the medications like an NSAIDs. And here we have to think about the adverse effects of an NSAIDs, like what is the one which is really going to benefit to the patient. And definitely we cannot go on a prolonged therapy of an NSAIDs. We know its on adverse effects, how it happens, what happens if you give it for a long period. So I've seen the people come with a really, a renal failure by taking only analgesics, and that has to be really, given them to proper advice. And topically, come over there in search of, relieving the pain for them. And next is very important is the nutraceuticals. So nutraceuticals, like what we are going to discuss in right now, in next few slides, has tremendous, given advantage to those people who really have a pain and to introduction of the pain. And if it doesn't come down, next lap of the people who are in the grade 2 to grade 3 going and all, then we have formulations like we try to give it hyaluronic acid injections to give it, and we have got a PRP injections, or sometimes give it in combinations. All these are all next step of level of treatment options we have got it. And when all this fails, when we have got a grade 4 arthritis, definitely we don't have any options in reducing it. We have to go for a surgery in the options of, we may have to go for a, initially, if it a one unicompartment or a bicompartment, we may have to go for an osteotomy, and depends upon open vaginostomy and a closed osteotomy, depending upon the surgeon preference. And if it doesn't, still the patient do not agree for the osteotomy, we may have to go for a total knee replacements. So this is from mild to severe in the peak goes up. So with the patients who has got a mild to moderate, so what is our initial line of treatment should be? Should we stick on to the topical NSAIDs? Should we go for a systemic NSAIDs, or in combination of the NSAIDs plus disease modifying, for osteoarthritis drugs, which is there, and only paracetamol? So this all comes with our experience, how we can keep up with the these type of a treatment without giving them then adverse, the adverse effect of these of the drugs. So if we are talking of the disease modifying in osteoarthritis drugs. So these are all the one which probably in the decade to the 2 decades before we were using it. I believe that when the 2000s, 90s and all, we were using the very fantasy of using the glucosamine and chondroitin and sulfate. Yeah, still some people, still they use this, the glucosamine, and this has gotten a small effect. And the importance has a little bit coming down because of the introduction of so many of the advanced drugs which we have gone to the collagen peptide like a type 2 and all. And the other, like the rosip, which commonly used, and the curcumin, and we have seen that the boswellia aflapin, or the aflapin, which I'm going to talk about in the aflapin in my talk in future. So the combination of this aflapin and the undenatured collagen type 2 has got a synergistic effects. So both have been clinically tested, and the beneficial effects we are going to see in our future, in our next slides, how it is going to tremendously help our patients in getting relief of the pain. So which is the most commonly preferred, the disease modifying osteoarthritis drugs in our clinic practice? I would like to ask the people who are there, who are talking about it, they can chat us with us, because each and every one will have our own type of mode of treatments. Not one is the superior, not one is inferior. So I would like to ask the people who are there in the forum to have any other their own view to come in a chat line. What is their mode of treatment with chemist? So do we are discussing this in the future? Let us know about it. So once if it started, how long that we are going to use this disease modifying drugs? Yes. So these are all the two important, because when we use this in our practice, how to use it is the most preferred, and how long we are going to use. So that is going to decide about in the disease modification. And we know that because this an arthritis is not a end stage. Once if it starts in the grade 1 to a grade 2, it's a progressive diseases. So our point of concern is how to slow the progress. This is most important. So many people will come in a day-to-day practice in hospital. So I've got a disease this, and is any other way for me to stop this, the disease? Definitely. So we have in a concern that, so we are going to lessen your burden by slowing down the process, by giving a link. That is the missing link, which is there here right now. So let us understand one thing, like what is this pathogenesis of an osteoarthritis, how it is going to do it. I know definitely most of our orthopedic surgeons, they would have undergone all this type of, read about this. But let me finish in a few lines about it. There is a two pathways in pathogenesis of an osteoarthritis. So one is the mechanical pathway and other is the immune pathway. So the mechanical pathway comes with the breakdown, and the immunological pathway is once if there's a breakdown, it stimulates the immunological process, which releases the interleukin 1 and tumor necrosing factor or alpha accumulators, which invariably, which retrograde, derives the, destroys the cartilage. So that is how this happens. And the inflammatory starts in, which is the cause of the symptoms of an osteoarthritis. So the inflammatory response because of a destruction of the cartilage and the immunology pathway both causes the pain in the people with an osteoarthritis. So here the chart which gives about the outline when mechanical stress or cartilage brings down this, and immunological pathways again goes with the cartilage destruction because of the T cells and causes the inflammatory and bleeding symptoms of an osteoarthritis. So for comprehensive management of an osteoarthritis and the control of the pain in the pathways, so both has to be addressed. That is, the mechanical and immunopathway is required, and that has to be altered to relieve the pain from that. So the rational approach to the management is directly with giving a native undenatured type 2 collagen and which supplemented with an aflapine boswellia extract in combination. So what is this aflapine does about it? The aflapine is just like boswellia, a derivative from this energetic composition, which is derived from boswellia, and this has a 3,0-acetyl 11-keto beta boswellic acid. It is specifically called beta serrata non-volatile oil, and it is a selective and potent 5-lipogenase inhibitor. So thus, its action is directly acting on the inflammatory pathway. And this, when it acts as, it promotes the cycle by increasing the glycogen and so thereby control of osteoarthritic progression and relief from osteoarthritis. So what does this undenatured type 2 collagen do? It acts on our immune-mediated pathway by turning off or slow down the immune response to the inflammatory stage damage, which is caused by the T cell response. So by acting on this against the endogenous type 2 collagen. So the immunitated pathway is been activated by the type 2 collagen. And so the T helper cells develop a tolerance, which thereby attenuating the immune response against the cartilage collagen. When the immune balance thereby shifts towards the T regulatory cells and increased anti-inflammatory cytokines like interleukin 10 and tumor growth factors beta. So that is how it acts on with the combination. And this rationale for the combination is, we know in our slide that the symptom for the both to cause an osteoarthritis is from an osteoarthritis is it has to have an immunological and a mechanical way. So we have to have a medicine which rationally and has a combination to halt both the mechanical as well as the immunological pathway. So this has to be altered or stopped in between. That will cause the symptoms to start a progression to affect. So the native undenatured collagen in this slide shows that how it works on the immune pathway, turn off the immunological response against endogenous type 2 collagen, and which reduces inflammation and degradation. Aflapine, here the same which has been explained in the previous slides, works on the mechanical pathway, selective and potent 5-lipogenase oxygen inhibitor, suppression of leukocytes, and cause reduces the pain and inflammation. So this action on different pathways, one is a mechanical and is an inflammatory, this has a better control of an osteoarthritis progression and provides relief from osteoarthritic symptoms. And another advantage of the combination is it corrects faults in the immune system to reduce the cartilage destructions. And you know that aflopine prevents formation of inflammatory mediators to reduce the pain in inflammation. If it is both anticollagen, undenatured collagen 2 plus aflopine improves glycosaminoglycans production in the chondros. We know that what is the protein need in the cartilage from the chondrocytes, because when the cartilage is destroyed, thus proteoglycans is definitely it is reduced. So these two combinations, by reducing the inflammation and supplements the formation of this glycosaminoglycans, and naturally by increasing this alleviates the joint pain and improves physical function ability in as early as possible, and which reduces the joint stiffness and improves the quality of life of an osteoarthritis. And we see that in a future slides then how significant reduction in the VAS, WOMAC, and LFI scores. There are a lot of clinical evidences which shows that native undenatured collagen type 2 plus an alpha extract, how benefit is going to use it. And then original research article from the authors Chandradhar, Sanathan Behra, and Rajiv Anand, they shown that the real world study evaluates that the efficacy and safety of an oral formulation of the containing undenatured collagen 2 and falfapine has benefited for the treatment of an osteoarthritis of the knee. And this data of 505 ambulatory adult patients, this treatment treated from 21 to July 22, most genders having an osteoarthritis of the knee received study treatment and once only for a period of 90 days. So you can see that the combination is being given for a period of 90 days. And after giving that, the UMAC score has shown that definitely it has come down from the scale of 70 to the almost nearly down to the 20 to 10 for a period of 90 days. That means a 3 months period. And again, the joint stiffness, with the pain and stiffness, has come down to from 14 to 4 to 2 for a period of 3 months. And VAS score again has really significantly improved. What about the safety and conclusion? So there are no adverse effects actually reported by any of our patients due to the study period. And definitely we are going to discuss about this, how our other people, have their idea about this and safety. And to conclude that what is saying is an excellent safety and efficacy profile of an undenatured type 2 collagen. And this combination with an aflopine, it's a desirable pharmacological treatment modality for a management of the patients in there. Clinical studies of this shows, the various, the Mehra, Balkin and all, the outcomes as definitely, significantly towards the improvement side. Again, clinical studies on aflopine osteoarthritis by the Vishal and Sen Gupta, they show that it alleviates the pain and improves joint function at the end of 30 days. And VAS, WOMAC, and LFI scores from other patients, from other significant studies, they shows the 90 days of the duration. So native undenatured collagen with type 2 and aflopine, which dosage, it comes in a hard gelatin capsule, contains 100 milligrams of aflopine and 40 milligrams of undenatured collagen type 2. And the recommended dosage, which this is 1 capsule daily. So to conclude and take home my message, so both immunological and mechanical pathway paths are more important in and to degrade the pathogenesis of an osteoarthritis. Therefore, a multimodal approach is very important with agents which has got a both ways, which seems rational. And the combination of this undenatured collagen and aflopine seems to be a rational approach to meet the need gap in osteoarthritis, where the patient who doesn't want to take the NSAIDs for a long period and who needs definitely a medicine which has got a less adverse effects and definitely who can take it for a prolonged period, which is important, and which relieves the pain much more symptomatically in osteoarthritis along with the preventing of osteoarthritis. So it means a reasonable choice, a drug which is a reasonable choice for mild to moderate osteoarthritis. Thank you very much. So thank you, Wockhardt, and for this giving this one, and we will open for this for the discussion. Thank you.
Thanks a lot, sir, for this wonderful lecture. And I think your more insights will be very useful when it comes to practical management of this patient. So in your clinical practice, what is the average duration for which you give the combination in a mild to moderate osteoarthritis knee or other joints?
I gave it in for the most of the patients who has got an osteoarthritis, whether in the knee joint or the hip joint, and especially with the type 2. And usually I start with the NSAIDs for a period of 10 days or 15 days, and then
Okay.
immediately switch. With that, concurrently I use it. I don't switch on the later and on, but concurrently I use NSAIDs. Along with that, then there's undenatured collagen type 2,
Okay.
which has a combination of with the flapping. Yeah.
Okay. So in your clinical practice and experience, means you might have also used undenatured collagen type 2 alone. Did you find any difference between the combination and the solo drug? Or
No, I don't think so.
you're audible.
Yeah. Sometime previously, I used to give the undenatured collagen, and I used to give the medicine which has got a curcumin, boswell, or other combination, some
Okay.
other drugs. Now,
Okay.
with the combination is available, I don't think so. I need to add up any other drug to give
Okay.
for the patient. So that really, reduces the cost of the patient.
Okay. Now, when we talk about management of osteoarthritis, pain management is very essential. So adding
Yes.
these nutritional supplements to patient over the period of time, do you able to reduce the burden of NSAIDs and related drug?
Very much, very much. See, I have a practice in my, very high, different type of patients comes over there, educated patients. They don't ask for a NSIDs. They don't ask for, because when they go, I get a patient who say the Google patients. The moment if they take about the NSIDs, they come with it. I don't want a drug, diclofenac. I don't want this drug which is causing hypertensive. Like, they go with Google. Heterocoxib, which is not good for hypertensive.
Okay.
This diclofenac is not good for these patients. So they come with very well prepared. So for me, it is very easy for me to convince them, look, this is the one which is really very harmless for you. You can take for 3 months, 4 months and all, so that they release the pain indirectly, your joint stiffness, everything and all, and which is harm-free, adverse, do not have adverse effects, even if the patients who are taking with the diabetes medicines and hypertension medicines. So in that way, I can really convince them, and it's easy for me, and give it a therapy for 4 to 5, 6 months.
So you may be coming across, sir, the patients who refuse for joint replacement surgery and who has progressed disease. So in such patient population, does this apalapine plus undenatured type 2 collagen helps?
But not much about it. If the patient
Okay.
has got a grade 4 arthritis, who really, definitely, it is not that much of effective. They can use it for 1 or 2 months and all. After over a period of time, they'll come with, no, I'm not effective. Then definitely surgery is the only option for them.
Sure. And then in your clinical practice, when you stop it usually?
I usually give it for 5 to 6 months, I said.
Okay.
Take a break, in it for 3 months, and then again I'll restart.
Okay. So I think means related to the combination and therapy, means most of these questions are there which are practical in nature. At this is nutritional supplement, so the safety is not concerned, and I hope you have not come across any serious adverse effects of these drugs.
No, I haven't come out any adverse effects.
Yeah,
Only
because
adverse effect is no, I haven't come about anything, because I keep using this, for a months and years together continuously. Give in break, the 3 months or 4 months break, and again I restart it again.
Sure. So, sir, we are towards the end of this session, and I will request Mr. Shirshendu Mukherjee, who is a sales manager with Wockhardt Limited, to give vote of thanks. And I also thank you for this very insightful lecture, and I hope this discussion and lecture will help to manage osteoarthritis patient in a better way. because it's a need of India, I think, as you have shown the prevalence which is increasing, and there is definitely a regional variation to add to it. So over to you, Mr. Mukherjee, for vote of thanks.
Yeah, thank you, Dr. Ravi. First of all, I like to take opportunity to thank Dr. C Jagadeesh that on request he has bring out the time from his busy schedule. Thank you very much, sir, for your fantastic and very means the lecture was very prominent, very crisp. Thank you very much. The way you have really delivered the undenatured type 2 collagen and aflapin, the role in osteoarthritis. I like to thanks OrthoTV, and I like to thanks all the delegates, those who have attended this program. And this is a platform where we are sharing the knowledge, and we are continuing it because Wockhardt believes in absolutely in knowledge sharing, and we have a lot of products in our pipeline, which are the very soon we are coming with the in your toxin and oral levothyroxine. Also sector is a gram negative antibiotic, and maybe within 1 year there is another pipeline of the products we have, which is a 25 years research product. It is under trial, and that is a gram positive antibiotic. So we are here to give the mankind the better things, and we are there to share the knowledge. Thank you very much once again, Dr. Jagadeesh, for the
Thank you very much.
time you have. And thank you, Dr. Ravi, and thank you all the delegates, and thank you, OrthoTV, once again. So,
thank you very much.
good night, and thank you.
Yeah. So from the makers of Habit, I once again thank you all. And with your kind permission, should we close this webinar for all, sir? So I will request to close the webinar, and I thank to all the Wockhardians, as well as it's Wockhardt's Foundation Day, by the way, today.
Thank you. Thank you.
Yeah.
Yeah. So it's a coincidence. We are celebrating this. And then I also thank all the doctors, and have a good night. And
Thank you. Thank you. Good night.
Good
Thank
evening.
you. Thank you.
Bye.
Good evening.
Good night.
Bye bye. Good night.